Hello and welcome to Foundational Medicine's Integrative Care for IBD Intro course. Um, there are over 3.4 million people with inflammatory bowel disease in the English-speaking world. And 75% of people with IBD either currently use or would like to use integrative medicine. So that's 2.5 million. And about 40% of people with inflammatory bowel disease are not in remission at any given moment in time. So that is like a million people. You are probably one of those million people. You speak English, you are interested in integrative medicine, or you use it already, and you're not in remission. And that's why you're interested in this course. So, I've got some objectives for today. I want to introduce myself and the other members of the team here at Foundational Medicine as clinicians and educators. I want to talk about how to use this course that you've just started. I'm going to give you an overview of inflammatory bowel disease, what it is, how it happens, talk about what it means to me to take a science-based approach to naturopathic care of inflammatory bowel disease, and then I'm going to start talking about care and self-care in IBD. So I just want to highlight a few things about each of us. First of all, you can read all about all of us in depth at foundational-medicine.com. So about me, I am a FABNG. I'm a fellow of the American Board of Naturopathic Gastroenterology. So that means after graduating as a naturopathic doctor and practicing for at least 5 years, seeing a certain number of patients, I was able to submit some case papers and then take I think 4-hour board exam, and then I passed. So I became a fellow, which means I'm a naturopathic gastroenterology specialist. I'm also a professor. I teach the naturopathic gastroenterology course at one of the naturopathic medical schools here in the US. And I also love research. I'm the chair of the research committee for the Gastroenterology Association of Naturopathic Physicians. So those are a few things about me. And these are my colleagues here at Foundational Medicine. Dr. Natalie Sheeler did something which is uncommon for a naturopathic doctor. She did a 2-year residency. Most naturopathic doctors do a 1-year residency, or some, like me, do no residency at all. And so she did a 2 years residency and currently is pursuing a master's in public health at Johns Hopkins, which I'm going to mention later in today's presentation, one of the most prestigious medical schools in the world. And then Dr. Claudia Bustamante has additional certifications in functional medicine in addition to being a naturopathic doctor, and also worked in holistic health coaching, and then got a master's in nutrition and worked as a nutritionist before becoming a naturopathic doctor. And she conducts medical and educational visits in English and Spanish, which is awesome for us and for her patients. So that's us in a nutshell. And as of this recording, between the three of us, we're licensed in order by greatest to least population in California, Arizona, Massachusetts, Maryland, Colorado, Oregon, Connecticut, Washington, D.C., and Vermont. And who knows, you may be watching this in a month, in a year. We may be licensed in more places or may even drop some of these. But as of right now, these are the places where we can see people as patients, order and interpret labs and imaging, that kind of thing. And then we also do see people in other states for remote educational consults where we're just providing educational information. We're not diagnosing or treating. We're not ordering, interpreting labs and imaging. We're not prescribing drugs like we do in, California, Arizona, Vermont, DC, that type of thing. Okay, so that is us. I've introduced ourselves as clinicians and educators, and I want to talk about how to use this 9-part course. First of all, why are we focusing on patients with inflammatory bowel disease in the first place? And there are a few reasons. And one is IBD is so profoundly unfair. I fell in love with working with people with this diagnosis when I was just a student over 15 years ago. And, every sort of illness can feel unfair in some way. But when I see 1-year-olds pooping in their diapers with so much blood that they need blood transfusions, I'm like, this is profoundly unfair. And it's unfair at every level. And so I think it's a really gratifying population to work with. Also, there is a lot of room for improvement. there are some areas of conventional medicine, which I really respect, where conventional medicine really has it dialed in. And it really is, pharmaceutical medicine is in many ways the best choice for certain types of diagnoses at certain stages, etc. But for IBD, the conventional care, the best practice conventional care, still leaves a substantial number of people suffering with symptoms, sometimes very severe symptoms. So there's a lot of room for improvement over and above regular conventional care. Another reason I have found in over 15 years of working with people with inflammatory bowel disease that people with IBD really care for each other. They can feel this profound unfairness. And I cannot even count how many people have said to me over the years, yes, I want to try this therapy or that therapy to try to help myself. But I also want to try it to help move forward care for people with IBD in general. And a last reason to focus on is that IBD is very quantifiable. Some conditions are mostly or entirely based on patients saying how they're feeling, and how people feel when they have IBD is super, super important to how we care for them. But there are also certain sets of questions that have been used for many decades in all research studies about IBD, or many, many research studies looking at medicines and diets and other things. So there's a certain degree to which we can quantify the answers to certain questions of how people are doing. And then there are certain biomarkers that Dr. Sheeler is going to talk about in the Labs and Imaging module that really can give us numbers about how inflamed people are or how severe their disease activity is. So it's very quantifiable. So when we make hypotheses like naturopathic medicine can help people with IBD more than conventional care does, well, we can really quantify that numerically based on how people's numbers change as we work with them. So why are we offering this course? We found ourselves saying many of the same things over and over to people, kind of giving certain spiels on diet and on prescription drug therapies and on herbal therapies and fecal transplant and other things. And we thought people pay these high dollar per hour rates to see us. If we can condense like 5 or 10 visits worth of information into a course that people could take, well, that could be really potentially really valuable for people. One-on-one appointments can be very expensive. So we hope to offer this course for, just the cost of like a couple of visits. And we believe that self-care education can help a lot. We've done some of it, giving people handouts or little micro videos that we make. And we saw that benefit people a lot. So we wanted to make this really long course to hopefully benefit people a whole lot. And we really want to measure if self-care education can help a lot. And I want to take a little detour here and talk about one of my medical heroes, Dr. Atul Gawande. He's a medical doctor. He's a general surgeon in Boston, and he's an author. He's probably my favorite medical writer. He's written a bunch of books, some of my favorite books in the world. And he wrote an article in The New Yorker called The Bell Curve. It was published in 2004. And it was all about cystic fibrosis. And in it, he described in really beautiful historical detail how the life expectancy of someone with cystic fibrosis has increased from about 6 months old in the 1930s to like 4 or 5 years old in the 1950s. And then he describes how cystic fibrosis specialty centers started sharing their outcomes with each other and sharing their techniques with each other in the 1950s. And since that time, life expectancy has grown so much that people are routinely living until their 50s now. That is the genius of medicine. And to be honest, that is our dream at Foundational Medicine, to make ourselves vulnerable, like these cystic fibrosis specialty centers did, by recording our outcomes in great detail, great quantifiable detail with patients with inflammatory bowel disease, and sharing that with integrative and conventional care centers around the country and around the world, so we can all share what we do and what our outcomes are like to move things forward for everybody with inflammatory bowel disease. So that's our dream. Here's how we recommend you use this course. And actually, there are a few different ways. So the way we imagine it most is that you start at the beginning and take a module per week, learning alongside a peer group. And we hope to connect everyone with a forum. So you can learn and comment with people what your experience is alongside this peer group with other people with IBD who can share experiences of incorporating ideas from the course. That's the way we're mostly imagining it. But we're guessing people are going to use it a bunch of different ways. One is you can literally binge watch the entire course in a day. Wake up early, get ready to have your day, watch everything, and then you've kind of got that knowledge dialed in. You could skip around. We have the modules broken down by different parts, so you could watch the parts you're most interested in. The parts that are most relevant. Oh, I'm really interested in diet. I really want to make diet changes. Let me just watch the diet module. How can this course help you? You can try some things on your own. And of course, for liability reasons and in real life, if you have a doctor you can work with, it is absolutely best practice to run whatever changes you're doing past your doctor, your physician's assistant, your nurse practitioner, your naturopath, your chiropractor, your acupuncturist, whatever clinicians you are working with on the ground, run these changes by them and have them be your ally. So some interventions lead to self-experimentation. People change their diet all the time without a doctor supervising what they're doing. And we recommend working with people with supervision, but we know that some people are going to be trying some things on their own at some points. You can use this knowledge to guide care from your primary care provider or your gastroenterologist. You can use it to guide care from the naturopathic doctor you work with who's not an IBD specialist, or your chiropractor, your acupuncturist, etc. And you can even use it to help guide your care from us clinicians at Foundational. Like, us at Foundational, we're the ones doing the course. How would this guide how you're doing? Well, the truth is that all three of us here at Foundational Medicine are evidence-based medicine nerds. We love evidence-based medicine, and I'll talk about what that means a little later. But the three of us have different areas of expertise. I wrote the chapter in the most recent edition of Natural Approach to Gastroenterology on helminthic therapy. Dr. Sheeler is a co-author in that same textbook on fecal transplant, a chapter on fecal transplant. Dr. Bustamante is a licensed nutritionist. She's doing your section on nutrition. So we all love all of these things, but we have different areas of expertise, and you can use the knowledge here to help suggest what directions you want to go. We have our own different clinical experiences, and I can say for myself, I forget things sometimes. Many times I've been moving in a clinical direction and a patient says, well, what about XYZ? And I say, I was really thinking about ABC, but now that you mention it, that could be a helpful direction for you to go. So use this to help guide your own care. A few last notes on using the course. We have handouts for most or every module that can really help support your learning. We do treat kids with IBD. I've treated kids as young as 1 year old. And this course has a lot of info that could be helpful for kids, but it is not reliable for every age necessarily. So basically, we are giving the baseline information for adults with inflammatory bowel disease. And anytime you want to apply something to this with a kid, in this case, not just saying this for liability reasons, but really, really talk to that kid's licensed clinician who's helping to manage their care to see what would be appropriate for them. There is something called Clark's rule that we sometimes use with herbs, where we say we'll just take the kid's weight and divide by a 150-pound person by the kid's weight to determine the herbal dosing. And we'll talk about that a little bit in the herbal sections or some other sections. Occasionally we're mentioning kid-specific dosing. But if we don't mention kid-specific dosing, don't assume that you can use Clark's rule necessarily. Like, really talk to their pediatrician, pediatric gastroenterologist, naturopath, or whatever clinician you're working with. Same for pregnancy. Occasionally we will say this therapy is safe in pregnancy, or don't use this in pregnancy. But if we're not saying one way or the other, make sure to talk to your clinician. And We really hope to have a forum up and running by the time we release this course. We'll see if it happens, but it is a dream of ours to bring together, have a forum where people with IBD can come together and talk about integrative medicine and what they're doing to change.